Well, earlier this month, Indiana and the federal government ended pandemic-induced lockdowns and visitation restrictions in nursing homes and long-term care facilities, but interpretation varies greatly even among individual facilities. Brock Turner has the story.
The initial announcement was met with both hope and optimism, but 2 weeks after regulators instructed facilities to remove visitation restrictions, many caregivers say little has changed. Throughout Indiana, long-term care visitation policies vary widely. Some are adhering to the guidance, others remain fully closed to unvaccinated outside visitors. The federal government's policy is clear. A memo from the Centers for Medicare and Medicaid Services instructs, quote, facilities should allow indoor visitation at all times and for all residents, regardless of vaccination status, except for a few circumstances when visitation should be limited due to a high risk of COVID-19 transmission. Note, compassionate care visits should be permitted at all times. Those conditions have to do with the current facility outbreaks, if the county where a facility is located has a high positivity rate, or if the resident is currently in quarantine after exposure. While some variation is expected and certain visitation restrictions are common, caregivers say they're losing patience. Last week, State Health Commissioner Dr. Christina Box said families can file complaints with Indiana's Department of Health if their loved one's facility isn't following state or federal guidance.
Visitation inside should be open pretty much at all times. It shouldn't be just a half an hour visit anymore. And if you're having struggles with that, our website will have this information and how we've directed the long-term care facilities.
Box also insists ombudsmen can be valuable resources, but for caregivers, the prospect of lodging a state complaint can be a loaded decision. Mary Charlson is the primary caregiver for her mother, also named Mary. Her facility restricts visiting hours, and that makes her twice-daily visits complicated. Currently, she has to rush home after her school bus route to ensure she can make the facility's final appointment.
Okay, 424, backing out of my driveway right now. Thank God my mom is only a little over 3 miles from my house. Off to visit.
This is a place that my mom is going to be probably for the rest of her life. So would I want to burn any bridges? No. Do I feel like the employees that are in there are care for my mom and love my mom? Yes.
Charlson doesn't blame the facility's staff and insists they've provided good care for her mom, but she wishes the facility's corporate owners would provide more clarity on their visitation policies. Zach Cattell, the president of the Indiana Healthcare Association and Indiana Center for Assisted Living, believes facilities will meet the guidance quickly as they have with past policy changes.
Visitation was never an issue prior to the pandemic, and I think everyone is eager to return to normalcy within the ambit of these being open and welcoming communities. We're coming out of a years-long restriction with a lot of still nuanced guidance that we have to follow. So I think just a little bit of grace for folks as they figure out these intricacies of what's restricted and what's allowed based on the state and federal guidance is helpful. I don't think anybody's purposely dragging their feet.
Charlson largely agrees, but struggles to understand the logic behind the policies. Her mom is fully vaccinated, and Charlson says she'll soon receive her second dose.
They should want us to be able to see our loved ones, and they should want to be able to have the residents happy.
Charlson's mom resides in a facility owned by American Senior Communities, and visitation policy varies widely within its facilities. Representatives from at least 3 American senior-owned communities say the facilities were not allowing in-room visitation. Other facilities by the same group said in-room visits were permitted from 8 a.m. to 8 p.m. One ASC facility said it was allowing in-room visits only to those vaccinated, something federal guidance prohibits. The company provided a statement but did not address the variation or a specific facility's policy. It's not just American Senior Communities. Caregivers in other facilities describe vastly different experiences when coordinating visits with loved ones. Charlson believes regulators should publish more strict guidance.
They're not making it mandatory. So then if a facility decides to go ahead and do this and something happens that it escalates, then it's their problem.
She says her and her mother look forward to the day when they're able to go outside for a walk or enjoy a carry-out pizza from the nearby Pizza Hut.
She'll ask me, if she can go somewhere with me. And I have to always tell her, no, you can't. You can't go with me, Mom. I'm sorry. We have to wait.
But for now, Charleston is just grateful to have the opportunity to hug and sing to her mom in person and not through a window on a stepladder.
When you're feeling sad and lonely, all you gotta do is call Pam and Mary. That's right. And I'll be here. Yay!
For Indiana Newsdesk, I'm Brock Turner.
We can hug each other.